Think your A1C tells the whole story? Think again. This crucial diabetes test might be feeding you false information. From hidden anemias to sneaky medications, several factors can skew your results without you knowing. Uncover the truth behind your numbers and learn why that perfect A1C might be masking underlying issues. Don't let a deceptive test result put your health at risk. It's time to look beyond the numbers. Number 1. Recent blood loss or transfusions. Your A1C test measures average blood sugar over the past few months by looking at hemoglobin in your red blood cells. But if you've recently lost a significant amount of blood or received a transfusion, this can throw off your results. When you lose blood, your body quickly makes new red blood cells, which haven't been exposed to sugar for as long. This can lead to a falsely low A1C reading. On the flip side, transfusions introduce red blood cells from a donor, which may have different sugar exposure, potentially skewing your results higher or lower. A 2014 study in the Journal of Diabetes Science and Technology found that A1C levels can be affected for up to 120 days following a transfusion. Always inform your doctor about recent blood loss or transfusions to ensure accurate interpretation of your A1C test. Number 2. Certain types of anemia. As we continue, please subscribe to this channel if you're finding this video helpful. Thank you. Blood disorders can significantly impact your A1C test results, potentially leading to misleading readings. Some types of anemia, particularly those affecting red blood cell lifespan, can cause inaccurate A1C measurements. For instance, in conditions like sickle cell anemia or hemolytic anemia, red blood cells break down faster than normal. This rapid turnover results in a lower A1C reading, even if blood sugar levels are actually high. A study published in the journal Diabetes Care found that A1C values in people with these conditions were, on average, 1% lower than expected based on their actual blood sugar levels. This discrepancy could lead to underestimating the severity of diabetes or missing a diagnosis altogether. If you have any form of anemia, it's crucial to discuss this with your doctor when interpreting A1C results. Number 3. Hemoglobin variance. Your genes can play tricks on your A1C test results, especially if you carry certain blood protein variations. These genetic differences, known as hemoglobin variants, can interfere with how the test measures your average blood sugar. For example, people with sickle cell trait or thalassemia may get falsely high or low A1C readings. A study in the Journal of Diabetes Science and Technology found that some variants can alter A1C results by up to 2%, which is a significant difference in diabetes management. What's more, these variants are more common in certain ethnic groups, including those of African, Mediterranean, or Southeast Asian descent. If your A1C results don't match how you feel or your home glucose readings, ask your doctor about testing for hemoglobin variants to ensure you're getting accurate results. Number 4. Kidney or liver disease. When your body's filtering systems aren't working properly, it can throw off your A1C test results. Chronic issues with your kidneys or liver can affect how your body processes red blood cells, leading to misleading A1C readings. For instance, advanced kidney disease often causes anemia, which can result in falsely low A1C levels. On the other hand, liver disease can extend the lifespan of red blood cells, potentially inflating A1C results. A study in the Journal of Diabetes Science and Technology found that in patients with end-stage kidney disease, A1C tests underestimated average blood sugar levels by up to 1.5%. If you have known kidney or liver problems, your doctor might recommend alternative tests like fructosamine or glycated albumin to get a more accurate picture of your blood sugar control. Number 5. Rapid changes in blood glucose levels. Sudden shifts in your blood sugar can paint a misleading picture on your A1C test. While A1C is designed to reflect your average glucose over 2 to 3 months, it's more heavily influenced by recent levels. A study in Diabetes Care found that blood sugar from the past 30 days contributes about 50% to your A1C result. This means if you've recently made significant changes to your diet, exercise routine, or medication, your A1C might not yet reflect these improvements. Conversely, a period of poor control just before the test could disproportionately raise your A1C. Some researchers suggest using a weighted average of multiple A1C tests for a more accurate long-term view. Always discuss recent lifestyle changes with your healthcare provider when interpreting A1C results. Number 6. Age and ethnicity factors. Your age and ethnic background can significantly influence how accurately A1C tests reflect your blood sugar levels. As we get older, our red blood cells tend to live longer, which can lead to slightly higher A1C readings even if blood sugar hasn't changed. A study in diabetes care found that A1C levels increased by about 0.1% per decade of life, independent of actual glucose control. Ethnicity also plays a role. Research published in the Annals of Internal Medicine showed that African Americans consistently have higher A1C levels than white Americans, even with the same average blood sugar. This difference could lead to overdiagnosis or overtreatment in some ethnic groups. Hispanic and Asian populations may also show variations. It's crucial for healthcare providers to consider these factors when interpreting A1C results to ensure appropriate diagnosis and treatment. Number 7. Medications affecting red blood cell turnover. Some medicines you take for other health issues could be secretly messing with your A1C test results. These drugs can change how quickly your body replaces red blood cells, which in turn affects the test's accuracy. For instance, drugs used to treat HIV, some antibiotics, and even high doses of aspirin can alter your red blood cell lifespan. A study published in Diabetes Care found that dapsone, a medication used for various skin conditions, can lower A1C results by up to 1.6%. This difference could mean the difference between a diabetes diagnosis or not. Erythropoiesis-stimulating agents, used to treat certain types of anemia, can also lead to falsely low A1C readings. It's crucial to tell your doctor about all medications you're taking, even over-the-counter ones, to ensure your A1C test gives an accurate picture of your blood sugar control. Number 8. Vitamin B12 or folate deficiency. Lacking certain key nutrients in your diet can throw off your A1C test results, potentially leading to misleading readings about your blood sugar control. Specifically, not getting enough vitamin B12 or folate can impact your A1C levels. These nutrients are crucial for producing healthy red blood cells. When you're deficient, your body may create larger, abnormal red blood cells that live longer than usual. This extended lifespan allows more sugar to attach to the hemoglobin, artificially inflating your A1C result. A study in the Journal of Diabetes and Metabolic Disorders found that correcting B12 deficiency in some patients led to a significant drop in A1C levels, even without changes in actual blood sugar. If you're vegetarian, vegan, or over 50, you might be at higher risk for these deficiencies. Consider discussing nutrient testing with your doctor alongside your A1C checks. Number 9. Iron deficiency anemia. Not having enough iron in your blood can sneakily inflate your A1C test results, potentially leading to overestimation of your average blood sugar levels. When you're low on iron, your body produces fewer red blood cells, and the ones it does make tend to stick around longer. This extended lifespan allows more sugar to attach to the hemoglobin, artificially boosting your A1C reading. A study published in Diabetes Care found that treating iron deficiency in non-diabetic adults led to a significant decrease in A1C levels, from an average of 6.2% to 5.4%. This difference could mean the difference between a prediabetes diagnosis and a normal result. If you're feeling unusually tired or have heavy menstrual periods, consider asking your doctor about iron testing alongside your A1C check to ensure accurate results. Don't let a single number define your health journey. Your A1C test, while valuable, isn't infallible. You might also want to watch this video for effective ways to lower high blood sugar. And please subscribe to this channel if you found this video helpful. Thank you for watching.